Hi everyone, surgery's done. I'm in the recovery unit now. I'm just a little bit sleepy. That's good. My name is Marissa. Welcome to my channel. You're watching Life After the Fontan, and this video is going to talk about my gallbladder surgery experience. So it's kind of ironic. This video topic is really what inspired me to actually start my YouTube channel. This topic was the catalyst to Life After the Fontan. And it's ironic because it's not even really a cardiac related surgery. Of course, there's different circumstances and exceptions because of my Fontan, but it's not a heart surgery, so it's funny that a gallbladder surgery had inspired a cardiac YouTube channel. The reason for that, when I was looking through YouTube to see of other people's experiences with their gallbladder removals or cholecystectomies, I was just thinking to myself, wow, it'd be so nice to see a video of a Fontan, of a single ventricle, of somebody like me undergoing this surgery because of the special considerations due to my Fontan. I couldn't find any videos like that, so here you go, YouTube. Here's your very first gallbladder removal surgery in a Fontan. You're welcome. Okay, so let's get started. So really, my gallbladder story. It started one night. It came out of nowhere. I've never had gallbladder issues in the past. I was laying in bed, going to sleep. I worked the next 4 days. It was a Thursday night. I was working Friday, Saturday, Sunday, Monday, 7 a.m. to 7 p.m. So for anyone in the healthcare field or anyone working 12-hour shifts, you know that's a pretty long weekend. I had everything ready for work. I had my lunches packed. I had my scrubs folded and ready to go. And then my stomach started bothering me. It was really like the upper portion of my stomach, from right below my sternum to like right above my belly button, all the way to the sides, and it was really bad pain. But I laid in bed thinking, all right, I'm waking up at 5, my alarm's set for 5, I have to work the next 4 days, I need to get a good amount of sleep to be able to do my job. And I just couldn't ignore it. Fast forward 2 hours, and I'm not going to give you all of the details, but fast forward 2 hours, my parents were called over here. I was having syncopal issues where each time I stood up, I almost passed out. I had just called out of work because I understood something was not okay. I just didn't know what yet. I was feeling very nauseous, very sick to my stomach. I was in the worst pain I've ever experienced in my life. There's nothing that I've had in my life that even compares to that night. It was without a doubt the worst experience in my life up until this point, and hopefully it stays that way. So I actually went to the emergency room via ambulance because my lips had begun turning blue. My tips of my ears were also turning blue or dusky, which is a sign that my blood pressure was probably really low and it wasn't getting the blood to the right, to really everywhere. It was only shunting my blood to the most important and most vital organs. In the ER, they gave me some pain medication and the pain went away almost instantly, and it really never came back. I had quite a few scans done in the ER, and I was admitted to the hospital just for observation and for diagnostic exams and all of that. I had a CT scan which showed some questionable findings near my gallbladder. I had an ultrasound which again showed some questionable findings, but nothing was really definitively found or not found. It was all questionable, which was the most annoying thing in the world at the time. Really what actually diagnosed the gallbladder issues was something called a HIDA scan, where they inject nuclear isotopes through an IV. I laid on this table with this big machine on top of me for like an hour and 40 minutes, and they watched the ejection fraction of your gallbladder. I'm a cardiac nurse. Ejection fraction, or EF, is something that commonly spoken about in the cardiac world. However, I didn't know your gallbladder had an ejection fraction, so that was pretty interesting to learn. Your gallbladder's ejection fraction should be between 30 to 35% or greater. Mine was 4. like 1, 2, 3, 4. So it really gave me a diagnosis of biliary dyskinesia or acalculous cholecystitis. They're thinking either of the two. I have no stones, but my gallbladder is pretty much not functioning. So I was supposed to have my surgery a few days ago. It was actually delayed because I was admitted to the hospital again for cardiac symptoms. I will be soon undergoing my gallbladder surgery, and I figured we would talk about it now before I was actually in the post-op period, because who knows how I'll be feeling afterwards. So for those that don't know, a gallbladder is really attached right below your liver. It looks just like this guy up here. Your liver sits on the right side of your abdomen and it produces your bile. Bile helps digest fats and break down fats after you eat a fatty meal. And then the gallbladder is really attached right below the liver, and that stores your bile, and that's what kind of puts it out into your intestinal tract once you eat something that has fat in it, really. So what they do for this is they have two different options, a laparoscopic procedure or an open procedure. Now I'll explain the laparoscopic procedure, and then I'll explain why it poses some increased risks for my Fontan. So with the laparoscopic procedure, they make 4 little holes into your abdomen, 1 right on top of your belly button, 1 right below your sternum, and then 2 on the side. The one right over your belly button is where they insert a tool to insufflate your abdomen, really just inflating it like a balloon. In order for them to see what's going on in there and remove the organ safely, they kind of have to inflate your abdomen. So they use carbon dioxide to do that. And then they take that tool out and put a camera in, and the other 3 holes are what they put other tools in to help take your gallbladder out, to take it off the liver, to clip the blood vessels attached, to do all the things. And then they take it out. Sometimes there's a risk that they would have to do an open gallbladder surgery where they would basically abort mission and cut a little hole on the right side of your abdomen and take it out in an open fashion. So there are some concerns related to this surgery, specifically due to my Fontan procedure. It's generally a laparoscopic cholecystectomy, a pretty simple surgery, but of course I have a Fontan, so that's not going to be the case. Because they're inflating your abdomen with this carbon dioxide, that has the chance to compress the inferior vena cava, which is the big blood vessel that is supplying blood from my lower extremities to my lungs because of my Fontan circulation. Once it's inflated, it compresses my inferior vena cava. That's decreasing my pulmonary blood flow, and that causes issues in and of itself. In addition, my one single ventricle sitting down there towards the center of my chest, that would also be compressed, which could decrease my cardiac output. Now, a decreased cardiac output basically means that blood isn't getting into all of your organs as it should be. For example, your blood pressure will decrease, your urine output will decrease. You could have cool extremities, maybe even some mottling, depending on how significant the decreased cardiac output is. So those are both things that they need to think about, specifically related to me with this surgery and my Fontan. So they actually plan on putting an arterial line in either of my wrists to better monitor my blood pressure throughout this surgery, and to also have a direct access to monitor my carbon dioxide through my arterial blood gases. Now, I have scars on both of my wrists from my old arterial line sites when I was much younger, and in my ankles, but I haven't had an arterial line since I was 22 months old. It seems really dramatic to me, but it's really the safest option to best look at my blood pressure as well as my carbon dioxide and really my respiratory status. And then additionally, because it's a surgery, they'll be putting a breathing tube down my throat just to breathe for me. I'll be paralyzed and sedated. It should probably only take about 45 minutes to an hour. I think the longest part would actually be intubating and then extubating at the end. I am expected to stay a night in the hospital afterwards, at least one night, they said. There is a very small chance that I could go home and I would be discharged that day, but I won't know that until the day of. So that's really what's going on. That's why I'm having my gallbladder removed. I hope nobody ever has to go through that amount of pain that I was going through the original night. So wish me luck. You'll be seeing me again probably the morning of my surgery, and I'll document that whole adventure for you guys. Good morning, everyone. It's surgery day. It's about 6:15 in the morning. I'm just getting checked in. I'll add some clips from throughout the day if I can. Hi everyone, surgery's done. I'm in the recovery unit now. I'm just a little bit sleepy. That's good. Hi everybody, let me start by saying I have absolutely no recollection of recording that last clip that you saw. It must have been just minutes after my mom was able to see me in the recovery unit. I had been asking her prior to my surgery date if she could try to record some videos while I was waking up from anesthesia just to include in this video, and that is what we've got. So secondly, I want to apologize for not having more clips from the hospital due to COVID-19. There were some changes with the unit that I was sleeping on for the night. There was very little to no privacy other than a curtain separating myself and other patients. Instead of being in a room, I was housed in a PACU for the night, so it was not ideal. I could not record anything just because it was so easy to hear other patients talking and patient information being shared past the curtain. I didn't want to even risk recording something that somebody would not want shared on a random YouTube account. So I apologize for that, but as a nurse, I ethically and morally couldn't allow myself to do it. Today is day 6 of recovery for me, but before we talk about recovery, let's discuss the day of events. So I went in around 6:15, as I mentioned in that one clip. I was taken back into a room by myself where I was put into a gown and the socks and a hairnet. I had to answer a few questions with the nurse, and then my mom was allowed back after like 20, 25, maybe 30 minutes. So in that room, I had my IV placed. Again, everyone came and visited me. I signed some consents, and then I eventually went back around 7:30, so it wasn't a long wait at all, and they were right on time, which was really, really nice. I walked myself into the OR and was able to jump up onto the OR table. To me, that's always the worst part, when you're laying on the OR table or the cath lab table or anything along those lines, and you're just waiting for the anesthesia to take effect, and you're in the room and you see all the big lights and you see everybody in all of their gear, and you look over and you see all the instruments for the surgery, and that to me is always the scariest part, just because I'm sitting there wondering, what if, when's the anesthesia gonna take effect? Can I be asleep yet? Am I gonna wake up as I'm supposed to? Which I did. So after a few hours, I came back out of the operating room. I was super excited to find out that they were able to complete my surgery laparoscopically instead of an open abdominal surgery. After I had fallen asleep, they placed another IV. So I had one in both hands. I had an arterial line placed right here. It's a tiny little dot, you guys probably can't even see it. Looks very identical to the 2 other IV sites, so not bad at all. When I woke up, I of course still had both of the IVs in, and I had the arterial line in. For those that are unfamiliar with an arterial line, I believe we talked about it earlier in this video, however, I'll just mention it again. It's really kind of like an IV, but larger, wider, longer. It monitors your blood pressure, your systolic, diastolic, and the map of your blood pressure. And then it also allows for really direct access to draw labs off of easily to look at your respiratory status and something known as an arterial blood gas. Once I woke up and my blood pressure was stable, they removed the arterial line. I was in a lot of pain, so I did get a lot of pain medication in a very short amount of time after waking up. I was then moved over to my room, which, as I mentioned, was really just in one large PACU with 15 or 20 other patients and no privacy, just curtains separating all of the beds. It made for a stressful situation and a restless night, to be honest, but there are much bigger concerns out there. And shortly after I was moved into my room slash bay slash curtained bed, I started having some lower blood pressures, which again isn't at all surprising due to the Fontan circulation and also the large amount of pain medications I was given. Due to my blood pressure, I wasn't able to get any more pain medicine for a little bit, and I was having a lot of pain. They didn't want to give me anything IV, so instead I had taken a pill for pain, oxycodone. And when that's taken on an empty stomach, you can usually feel pretty ill from that, which I did. My cardiologist was able to come by and see me. They had been concerned that I did not look well after surgery, but thankfully by the next day I was doing better. So let's talk recovery. I honestly have been experiencing more pain than I could have anticipated. Again, it was laparoscopic, but they still cut through all of the abdominal layers, including the muscle layer, which is probably the most painful part. And it really impedes your ability to use your abdominal muscles for a few days. So for the first 4 days or so, I would say I was really alternating between taking Tylenol and Motrin, and then they did give me a prescription pain medication to take if needed, which I did for the first few nights. I usually really try to stay so far away from prescription pain meds. I've slowly been reintroducing food back into my diet just because before I had this surgery, I was on a very bland, very low-fat diet in fear of causing another gallbladder attack. I do have some restrictions from this surgery. I'm not able to lift anything greater than 8 pounds for 6 weeks. I can't drive until I'm at least 24 hours free of any narcotic pain medication. My incisions look great. They all had steri strips on them, but they have finally all fallen off. It's been, again, 6 days. They're just a little itchy now. I'm not really having pain at the incision sites, more so just the abdominal muscle pain. Other than that, I'm really feeling a lot better on day 6. Day 5 was really a turn of events for me when I finally started feeling like I could get up off the couch by myself or pour my own bowl of cereal. And I know pain varies from person to person. Some have said that I don't really have a high pain tolerance. I don't know how true that is. I think they're probably right, but hey, that's not my fault. So if you're getting ready to have your gallbladder removed, or if somebody you know is gallbladder removed, a few things I would suggest. Make sure you have a pillow for yourself or your loved one after their surgery that they're able to kind of splint their abdomen with when getting up. I used my gallbladder guy right up here, and everyone at the hospital loved him. It really helps make it feel like your stomach's not going to explode each time you stand up. Heating pads really helped me a lot, so if your family members are going to be experiencing some pain and you don't already have a heating pad, I would definitely suggest investing in one. Don't be discouraged if you're experiencing more pain than you expected to have. I was really worried the first few days out, thinking I couldn't go for walks, I couldn't do anything that I was used to doing. I wasn't sure what was happening and why it was taking me so long to recover. Everybody recovers at a different rate. With that being said, if you're concerned about your recovery or your symptoms or something along those lines, I may be a nurse, but please remember I'm not here to give medical advice. Please call your own healthcare team with any questions. And lastly, I would suggest having maybe some ice pops or some Jello or something cold and soothing for your throat stocked in your house when you come home from your procedure, because you will have a breathing tube in for the surgery, so your throat may be sore for a few days. Mine was only sore for a day or 2. That's really it as far as my gallbladder surgery goes. Please remember to like this video if you enjoyed it or if it was helpful for you. Subscribe to my channel and turn on notifications so you can be one of the first to watch my newest videos. Thanks so much, guys, and good luck with your surgery if you're preparing for one.